How do different blood pressure meds work for stroke? Imagine your blood vessels as highways carrying blood to your brain. When these highways are narrowed or damaged, the risk of a stroke increases. That's where blood pressure medications come into play, helping keep those highways clear and healthy. Different types of these medicines work in unique ways to lower blood pressure and protect your brain from stroke. Calcium channel blockers are like traffic controllers that prevent calcium from entering muscle cells in your heart and blood vessels. This causes the vessels to relax and widen, making it easier for blood to flow. Not only do they lower blood pressure, but they may also help prevent damage to blood vessels that can lead to stroke. Some studies suggest they might even protect the heart and blood vessels from the harmful effects of high blood pressure over time. Next are angiotensin-Roman II receptor blockers, or ARBs. Think of them as blockers that stop a chemical called angiotensin-Roman II from narrowing your blood vessels. By preventing this constriction, ARBs keep your vessels open and blood pressure down. Research indicates they might also reduce the size of brain damage after a stroke and help with neurological recovery, offering extra protection beyond just lowering blood pressure. Then there are angiotensin-converting enzyme inhibitors, or ACE inhibitors. These drugs prevent the formation of angiotensin-Roman II, the chemical that tightens blood vessels. While they are effective at lowering blood pressure, some evidence suggests they might be slightly less effective than calcium channel blockers at reducing certain artery thickening linked to stroke risk. Diuretics are another class, working like a sponge that helps your kidneys remove excess salt and water. This reduces blood volume and lowers blood pressure. They are good for stroke prevention, especially in people with high blood pressure, but they don't have as much evidence for directly protecting blood vessels beyond their blood pressure effects. Beta blockers slow your heart rate and decrease the force of each beat, which lowers blood pressure. They are often used when there are other heart conditions involved. Their role in stroke prevention is less prominent, but they can be helpful in specific situations. Centrally acting agents work by acting on your brain to reduce nerve signals that cause blood vessels to tighten. This helps lower blood pressure from within the brain's control centers. In the context of an acute stroke, managing blood pressure becomes more delicate. Lowering blood pressure too much during a stroke can reduce blood flow to the brain's already damaged areas, potentially making things worse. Doctors often keep blood pressure within certain limits during the early phase of a stroke to ensure the brain still gets enough blood. Once the initial crisis passes, blood pressure is carefully adjusted to prevent future strokes. In practical terms, controlling high blood pressure with the right medication is key to preventing strokes. Some drugs like calcium channel blockers and ARBs may do more than just lower blood pressure. They might also protect blood vessels and brain tissue. During a stroke, treatment focuses on balancing the need to prevent further damage while maintaining enough blood flow to the brain. Always remember, individual treatment depends on your specific health situation, so it's essential to work closely with your healthcare provider. Proper use of these medications at the right time can make a big difference in stroke prevention and recovery.